So thank you very much for inviting me here today. And Dr. Kulos-Reed was kind enough to share her slides with me before. So I didn't want to try to duplicate anything she said. So hopefully I'll be kind of adding on to what she said. So I do apologize if I've kind of repeated anything you heard in the last kind of hour here. But what I hope to cover today is Dr. Kulos-Reed kind of reviewed some of the previous research that has been done in exercise, specifically for people diagnosed with multiple myeloma. I'm going to talk about primarily the research that we've done in our lab here in Edmonton at the Cancer Rehab Clinic in the Department of Physical Therapy at the University of Alberta. Talk about some past research that's now complete, some ongoing research, and then just as was mentioned with the grant that we're very thankful to have received, some research that we'll be doing in the future, specifically around individuals diagnosed with multiple myeloma. Then I'll try to take some of from that past research by others, research by us, lessons we've learned by working with individuals diagnosed with multiple myeloma, and talk about some specific things that we consider when we start somebody with that diagnosis in an exercise program, ongoing things we look at, and modifications that we often make in the program. So hopefully some kind of more practical information that might be useful for you in your own exercise journey. So Dr. Kulos-Reed mentioned the ACE program, Alberta Cancer Exercise. We just say ACE for short, it's much easier. So this is a study, as she mentioned, we're actually just into our 7th year of exercise programming now. So it's been an effectiveness implementation study. It's a bit of a sad day. It's a good thing we're done the study and we're kind of closing up our database. We'll talk a bit more about the numbers that Dr. Kulos-Reed mentioned, but we're closing the study up and transitioning to a program. None of this could have happened over the last 7 years without our funding sources and partners. So I want to acknowledge Alberta Innovates for initially funding the ACE study back for starting in 2017. We received additional funding from the Alberta Cancer Foundation and Beatrice to continue our programming going. And Alberta Health Services was and continues to be a partner as we try to still push towards implementing this as a program as part of cancer care here in Alberta. So what is the ACE exercise program? And Dr. Kulos-Reed mentioned Excel. So this is kind of one of the big studies that led to the Excel's building off of in Alberta and across the country now. ACE is just in Alberta. So a lot of these things will sound kind of similar. So it's a 12-week exercise program offered at no cost to individuals diagnosed with cancer. It's led by exercise trainers, so there's a few different sites and it's been a bit different across the province. But we try to use existing trainers that are already working at fitness facilities. We add on Dr. Kulos-Reed Thrive cancer-specific training. So now they have that extra cancer piece to work with people diagnosed with cancer, and they're leading the classes. Here in Edmonton, we'll see our partners, but primarily been the YMCA and Wellspring Edmonton. So we're no matter where the site you exercise, it's 1-hour classes twice a week. And the idea is that it's a full body workout. So trying to work all aspects of our fitness and from head to toe. It starts at a low to moderate intensity. So you don't need to be fit to start the program. The goal is to try to, a lot of people have never exercised before. They're just not sure where to start now that they've been diagnosed with cancer and maybe gone through some of their treatments. So it's kind of a starting point and trying to gradually progress over the 3-month period. So with the research study and trying to build that evidence that will hopefully help us get this implemented into cancer care in Alberta, all participants complete a fitness assessment and questionnaires at the beginning and end of the exercise program. The information from the fitness assessment also helps us to really kind of help tailor the exercise programming where we can to meet the needs of the individual. So the sites have changed over the course of the 7 years, but the primary locations have been Calgary and Edmonton right from the start. These are obviously affiliated with our primary cancer centers in Calgary and Edmonton here in Alberta. And then we also extended out to locations with regional cancer centers. So Red Deer, Lethbridge, and Grand Prairie. We were operating in a couple locations where there's community cancer centers, Medicine Hat and Fort McMurray. These last 2 locations are now fit the criteria for the Excel study that Dr. Kulos-Reed mentioned. Initially, all our program was in person, and then COVID happened. So we had to shift gears when all of our facilities and partners were shut down for in-person programming. So that's when we started virtual options via Zoom. Again, very similar to what Dr. Kulos-Reed talked about with Excel. And we've continued those virtual options for people that can't attend our in-person program for one reason or another, or some of our location, the numbers unfortunately have not come back up. So it's more cost effective for us to deliver those virtual options where we can reach a larger group of people. And I said this is the longest running study. It started 7 years ago, but it is still currently running. So just a little plug here. Our spring programs are starting across the province. So Calgary is a bit ahead of us. They're starting, I think, as early as next week. And ours are starting here in Edmonton area shortly after Easter. So you can see the website link on the bottom of this slide in the next few coming up. So if it's something you're interested in, you can go to the website. The programming information is there. All the contact information. There's still a chance to get in to our spring exercise programs. And so just to kind of show what ACE looks like, and I don't have Calgary pictures, so I'm kind of cherry picking our Edmonton locations here. Here we offer 2 different types of exercise training. So on the left is a circuit training class. So in Edmonton, this has primarily been at the YMCA in Grand Prairie and Red Deer. It's been at community fitness facilities, but these are 1 hour group fitness classes. People come in, they do a warm-up led by the instructor together, and then they do a series of 8 exercises. At the beginning of the class, the instructor demonstrates all exercises and trying to reach a wide range of abilities and where people are at in their exercise journey. Each exercise has at least 3 different versions demonstrated, and there's always further modifications available if needed to try to get everybody working at relatively the same level. They do each exercise kind of in a pattern of 1 minute of exercise with a 30-second break. And after you've gone through the 8, there's a longer break in the middle, and then you repeat the exercises the second time, and then you finish off with a group cool down and stretch. Our group personal training locations, which in Edmonton has been the Wellspring Edmonton House, and here at the University of Alberta in our cancer research clinic. And we do basically it's more of a fitness gym-based workout where you do cardio warm-up on, you can see treadmills, bikes, elliptical machines. Then you do a series of exercises, again, designed to get head to toe, about 8 to 10 exercises on strength training machines, using dumbbells, resistance bands, body weight. There's a range of exercises that would be done, finishing off with some core work and balance, and then a cool down and stretch. Again, both locations, it's designed to be roughly as close to 1 hour as we can. And our virtual classes, when we made that shift, the idea was kind of based off more of that circuit training, our group fitness class. So it's more that format that we have at the YMCA's here in Edmonton. And that is also was modified to be done with less equipment and less space because there's a wide range of what people have available at home. And specifically with the multiple myeloma participants that we've had participate in the ACE program. So I know Dr. Kulis-Reed said over 2,500. The numbers are kind of going up and down in our database with the study ongoing, but we definitely have over 2,000. Initially, our goal was to have 1,000 in 4 years of recruitment. We went over that in 2 years. So we upped the goal to the 2,500 that, as she mentioned, we've now reached. Of those individuals that have participated, 87 have a diagnosis of multiple myeloma. So this is just over about 3% of our sample have had that diagnosis, which compared to the numbers in the population, depending on estimates, would be about 1.5% to 2% of people diagnosed with multiple myeloma. So we're quite happy that we've been able to have a representative sample from this cancer group in our study. As far as enrollment, we've kind of noticed some changes with COVID. So before COVID, we'd have about 5 participants per session that were diagnosed with multiple myeloma. And our sessions, we have one in the winter. It's actually just ending now. We have a spring session that runs from April to June, and then a fall session. So we have 3 per year. So we'd have about 15 per year before COVID. During COVID, which was these numbers are from spring 2020 to the end of our spring session in 2021. So actually encompassing 4 sessions, we only had about 1 individual diagnosed with multiple myeloma per session, and now we're back up to 6. So we're not quite sure, and this has led to some of our other research trying to explore why this was the case and how maybe we can better serve the needs of people diagnosed with multiple myeloma, because we would prefer to be helping more people with this diagnosis. And as far as specifically the individuals diagnosed with multiple myeloma in our program, the average age is just under 65, but you can see the range from 37 to 80 years of age. That's a bit higher than our study. Again, it's kind of a floating number as the study's still running, but it's about 60 years old is the average age, so slightly older than our average participant. The number of females of that 87, or females and males, 47 and 39, so one person must not have filled that box out on their questionnaire. But this is actually better, so it's about 55% of the multiple myeloma participants are women. This is, so we actually have a better number of men in this cancer group. Overall study, we have about 70% women and 30% men. So it's nice to have men better represented in our program for the specific cancer. But still, if you look at the overall incidence of new case from the Canadian cancer statistics, males are more likely to get multiple myeloma slightly than females. So we'd still like to balance that number out even more if we can in the future. And just to talk about some preliminary results, again, the study's ongoing and these numbers are changing, but just to kind of share some of the benefits we've seen of people diagnosed with multiple myeloma who participated in our program. So the first number, the EQ5D5L, I won't test you on the acronym, but basically it's a health-related quality of life measure. And there's a general wellness or kind of people basically rate how they feel their overall health is today. So 0% would be worst health and 100% would be best health. So they do this at baseline before they enter the program and at the end. And you can see that number goes up on average from 65 to 69% over the 3 months. The little asterisk beside means that's a statistically significant improvement in how people rate their own health after completing the program. Pain, which can be, I mean, it's very generic, but unfortunately very common for many people diagnosed with any cancer. So people, about 3/4 of the multiple myeloma participants rated their pain as mild or greater at baseline, and that number drops to about 58, just under 60%. So not significant, but nice to see a drop in that symptom of pain just by getting moving appropriately during the program. And sit to stand, which is a very good functional test because we all have to get up out of things like beds, toilets, chairs all day long. So this is the number of getting up and down out of a chair in 30 seconds. And we can see that number goes up from about 13.5 on average at baseline to just under 16 at 12 weeks. So about 2.5 times in 30 seconds, which is quite a lot when you think about that movement. And again, this reached statistical significance. So some really good kind of quality of life from the patient perspective improvements, and as well as some functional improvements from the objective outcomes that we measure related to physical function and exercise. And as far as completion rates, they've been quite good for people diagnosed with multiple myeloma. The questionnaires is over 80% completion rate. This is including before and after the program, a 70% rate of fitness assessments before and after, and then the adherence to the actual exercise program, again, twice a week. So depending on the exact session, at least 20 sessions up to 24, depending on the location, is over 80% adherence. But again, the nice thing about ACE, because we have this large sample size and we have people of many different cancer diagnoses in the program, we can really kind of start to look at different groups and to try to see, are we really meeting the needs of this specific cancer diagnosis group? Are there ways that we can kind of modify things within the study to better meet their needs? So when we look specifically at people diagnosed with multiple myeloma, so this is that breakdown of those 87 participants. When we look at people that do the circuit training, so these are primarily our community-based locations where the trainers have taken that cancer training, less support direct from our research staff. Still support, but not as heavy as some of our other locations. And you can see the questionnaires, the fitness testing and attendance are all a little bit lower at those locations. When we look at our group personal training or our tailored exercise, so that would be here at Corbett Hall in the University of Alberta and in the Wellspring in Edmonton, and I believe Dr. Koulis' Reed's Thrive Center she mentioned at the U of C in Calgary there. When we have that more tailored training and a bit more direct supervision, more research staff working on it, we can see the completion rates are much higher and the attendance is higher. And then we did have, when we started virtual, so the numbers aren't as high here because we just did it over COVID and a lot of our programming has returned to in-person. But we see that of the participants with multiple myeloma that have participated in these programs, extremely high rates of questionnaires and completing fitness tests and also attendance. So obviously there's some factors. So we've tried to tease these out, and I'll talk about some of the further research that we've done to try to tease out this benefit. But clearly things like virtual seem to be appealing to virtual programming, seem to appeal to individuals diagnosed with multiple myeloma participating in our exercise programs, and also that element of that more specific tailored exercise with a bit more supervision, which kind of lines up with some of the previous research in individuals diagnosed with multiple myeloma. So I'll take a bit of a step aside just because this will lead into other research that we've now done to talk about an app that's being developed here at the U of A. So my direct supervisor, Dr. Margie McNeely, who's a professor here in the Department of Physical Therapy, met up with some researchers in the Department of Medicine here at the U of A. And this was in the works before COVID, this idea of creating an app that could provide with expert-based content, could provide support for people in multiple aspects of health with chronic disease to improve hopefully their condition moving forward. With COVID, this became very relevant, and the work to kind of get this app going has stepped up and been a big part of the work that's been done in our research lab and with our colleagues here across campus at the University of Alberta. So we'll just talk about the app quickly and then talk about how we've used it in some of our research now, and we'll continue to use it in our research. So what the app is, so on the left here is kind of a screenshot. There's an app on a phone and also an app that you can log into just on any kind of device, computer with an internet browser. So the app would look something like the purple kind of logo you see there. All these buttons, the nice thing about it is it's scalable and changeable. So, and I should say, go back, HEAL Me stands for healthy exercise, active living, and mindful energy. Sorry, I'll just put it right there. It's a bit easier to see. The idea is, so the initial thought was to, focus on eating, exercise, and mental wellness, but because of the scalability of the app, some studies in our lab have focused more on physical therapy. You don't have to do all the diet, exercise components. It's often hard to do and overwhelming for participants to do all of them at once and to encompass in one research study, but it does have that capability to tackle many aspects related to healthy lifestyles. So that's kind of what the app would looks like. So you would, if you're in the study, you'd be enrolled, you'd have access to this app. There might be, we can offer our Zoom exercise classes. The link, even signing up for those classes, can be done through the app. There's also video-led exercise sessions. So we're lucky enough to be connected with some professional film crews, and they filmed a number of exercise performance videos. So we can actually piece together a workout, and the video can kind of run front to back, almost as if you're doing a 1-hour exercise class and you just follow along with the videos as you're doing it. There's instructions, demonstrations, all the same things that we do in person. So we have that ability to do live exercise classes, but also these video-led sessions are kind of good because people can do them on their own time when they're feeling up to it and when it fits into their schedule. And we are lucky enough to be connected with dietitians, exercise physiologists, physical therapists, medical doctors, who else? Behavior change experts, implementation science experts here at the U of A. So when we want to create this content, we're really getting experts to lead evidence-based modules to really have good information to provide with participants using the app. And just, there's been a few clinical trials now that have used the app, and it's still, the app's evolving. We're waiting for the next iteration to come out. So we use the information we get from these clinical trials to try to continue to improve the app. But what we've seen in the 3 clinical trials, so about over 250 participants have gone through different research studies, not all focused on exercise. Some have been, again, on the mental health and diet side. But with those that have done exercise, we've seen a 25% improvement in a lot of our fitness outcomes on average. And we've also seen a reduction in depression, stress, and anxiety. So that aspect of mental health, we're reducing the things that we want to and improving the things that we want to. And of those 250 participants, about half have been individuals diagnosed with cancer, various cancers. We're also working with a group that does specifically work in liver cirrhosis, lung transplant, and COPD. So the idea is this app can be, again, modified to meet the needs of different chronic disease groups. And you can see the adherence to these 3 clinical trials. So the group exercise sessions, so this is when people are meeting live, classes led by an instructor, just under 90%. 82% for those independent sessions when they've been provided videos to follow for workouts, and then right around the 80% mark for nutrition sessions. And there's more research coming, including that study that I'll talk about in a bit. But the nice thing about the app is with the idea to scale it and change the components. There's a study that's going to be looking at prehab, preparing people for surgery, which is similar to the study that we're hoping to do with individuals diagnosed with multiple myeloma. There's trials looking at, again, liver cirrhosis has been our colleagues that have helped develop this app, a big focus of their research, and mental health intervention looking at chronic disease across many sites. So really usable in particularly in today's world, in the post-COVID world. So the reason I want to talk about an app, because it's been part of a couple studies that are been done specifically in our lab with individuals diagnosed with multiple myeloma. And again, we're hoping to use it in the study that was graciously funded by Multiple Myeloma Canada. So one of our master's students during COVID had worked with our in-person programming with ACE, with people diagnosed with multiple myeloma, and wanted to focus on trying to use just the exercise component of the Heal Me app to try to deliver an virtual exercise program to individuals diagnosed with multiple myeloma. And he was recently finished his master's and published his data. So we'll just highlight some of his findings today. So the objectives were first to see, so we're doing this virtually with individuals diagnosed with multiple myeloma. Is this a safe and feasible way to offer exercise program to these individuals? We also wanted to know, because the app is still new and in development, is the actual delivery of the program through the app and the perceptions of the exercise program and the application, is this kind of deemed acceptable, useful, understandable, all these things technology-wise for the participants using the app. And then we still want to see, we know we get certain levels of improvements from our in-person programs. Are we seeing similar types of improvements from our functional and quality of life outcomes when we're doing this virtual intervention? So Graham, in his master's, ran a 12-week exercise program. It was individually tailored and virtually supported. There was 3 different exercise modes included in the program. So there was 1 group workout per week was the goal of the one goal of the program. So again, this is very similar to the ACE circuit classes that I talked about. A 60-minute full body workout. This is 1 time a week. Then there was independent home workouts. So that's on the bottom on the left is kind of a little Zoom screen. That's where Graham led the classes from his own home during COVID. In the middle, we have those exercise videos. So a workout was put together, often the same workouts that people were doing in the group class. So they had some familiarity with them before they even did the videos on their own, where they could follow through the videos for 60 minutes on their own time when they felt they had the energy and felt up to it and it fit into their schedule. And then they were also given a target from trying to get, for most people where they were with their baseline activity, trying to get up to 90 minutes of moderate intensity aerobic exercise outside of these 2 workouts. And the primary mode for most people in the program, in the bottom right, that's why the image is there, was walking to try to increase that activity on their own outside of the other 2 workouts. And the program was shown to be feasible, so there was a very high adherence rate. So nearly 90% of the virtual supervised group workouts were attended by the participants in the program. The independent homeworks dropped a little bit, so without having that direct supervision, but still quite good, 83%. And then the aerobic exercise, that goal of trying to increase the number up to 90 minutes per week over the 12 weeks was 90% as well. So very good there. There's a very high completion rate. They also, they did fitness assessments and questionnaires before and after the study, and 93%. So very high follow-up rate there. There was some adverse events, we wouldn't say serious adverse events that required medical intervention, but these were minor soft tissue injuries where there was patients rated back pain from mild to moderate, bordering on severe for a couple of cases. So nothing required medical intervention. By modifying the exercise and rest, nobody had to discontinue the program. So obviously with multiple myeloma and often people having involvement with the spine, very important to report this information and be mindful of it when exercising. And as far as the self-reported outcomes, people felt that their own quality of life and physical was improved. And then physical function from fitness assessment, they talked about that sit to stand test, up and down, plank, which if you know the plank, you're probably making a face right now, the core exercise, the plank time, the endurance time improved for that test, as well as balance, which was measured with standing on 1 leg. So there were some functional improvements and improvements from the patient perspective and their own quality of life with the 12-week program. And as far as the app itself, so this was information was collected via questionnaire and then individual interviews to try to get a bit more detail into people's perception of using the app itself. So overall, people were satisfied with using it and felt it was a beneficial way to deliver the exercise program. Some of the strengths overall, people felt that the support and supervision and responsive nature of the study staff was really important to their success in the program. And they really liked the diverse exercise options. So there was 2 components to that. One was the 3 different ways that the weekly sessions or weekly goals were trying to reach. So the live class, group class, the 1 exercise on their own led by the video, and then reading the aerobic goal. They liked the variety and diverse options there. And also the modifications and options that were provided in class of different ways to do the exercise to really try to meet people where they're at. So I won't read the quotes out to you out loud, but basically just wanted to highlight some of the findings from those interviews. So again, not everybody, there were some technology challenges. Not everybody's super comfortable with the app initially, but most people found it user-friendly and that they could use it. And again, getting at that idea of the live class, and during COVID, a lot of people felt isolated. So even though it's virtual, there's still that group element. So people really like that idea of, feeling like they're in a real class and part of a group. And then from the perspective, and we'll talk a bit more about this when we get to the kind of the considerations for people exercising with multiple myeloma, but suppression in immune function can definitely be an issue depending on the specific phase of treatment and even following treatment. So the idea of being able to do it at home, having their own equipment, their own environment that they felt in control of, reducing the risk of infection, germs. There's a lot of people appreciated that aspect of the virtual program. So we're starting to see some good benefits and kind of fine tuning, what may be the best option as far as delivery program for people with multiple myeloma. So this led to another research study that has just recently been accepted for publication. And this was really getting at a specific phase of common treatment for people diagnosed with multiple myeloma, looking at that period of when they're undergoing chemotherapy prior to a stem cell transplantation, because we received advice from medical connections working within Alberta Health Services that this would be a time that would be important to support people in exercise to prepare them for the stem cell transplantation and recovery afterwards. So we really wanted to delve into the specific period of the cancer journey for people with multiple myeloma. And this particular study, so the idea was we really like to engage with patients to find out what they feel is going to be best way for us to deliver exercise interventions to them. We don't just want to assume we know what's going to be best. Always hearing it from the patient really helps inform how we should approach delivering our interventions. So there was 26 participants. They had already undergone a stem cell transplant specifically for their diagnosis with multiple myeloma. So this is kind of retrospective, looking back at their experience. So it was a mixed method study. So they gave a questionnaire where they kind of had the response options from 0 to 5, that sort of thing, and then followed up with focus groups where, again, we could have more open-ended questions and discussion to really get the details of what would make a good program for individuals in this time phase of their cancer journey. And as far as the results, people felt that they had a good knowledge on the benefits of exercise. And often when we talk, I don't know about Dr. Koulis-Reid, but we talk about exercise being good for people with cancer, people kind of go, duh, exercise is good. But they felt they had that, but they didn't really know the specifics of, what was good for, why it was specifically good for multiple myeloma, and how they could really exercise safely. So they knew it was good, they should be doing it, but they weren't really sure how to go about approaching. And the barriers they felt that they had, just highlighting that again, that limited knowledge and skills to actually exercise safely. They felt there was a lack of healthcare provider support. So physical therapists within AHS often offer therapeutic exercise to deal with a specific issue, but don't have the expertise when it comes to general conditioning that exercise professionals have. Excuse me, you can have a sip of water. So not having, unfortunately, a lot of exercise specialists available directly in the healthcare system, they felt that was a bit lacking. And then they also found motivation could be low just because of the emotional toll of the chemotherapy experience itself. What they found was helpful, though, was social support from others. So spouse, family, caregivers, friends, and healthcare providers, there's the social support there, encouraging them to exercise. And then they had the goal of wanting to be in good shape before that transplant. So the chemo itself is kind of demotivating, but knowing that they wanted to prepare their body for what was coming was motivating on the flip side. And then that was primarily from the questionnaire and a bit from the interview, but the focus groups at the end really kind of dialed into what participants' preferences would be if they were to do an exercise program during that time phase. So these key features that they highlighted were a mild to moderate intensity. So again, not starting off with that heavy exertion, kind of, easing into the program, which we always encourage, and a combination of aerobics, so more that endurance exercise where we're getting that cardiovascular benefit for the heart and lungs, but also that resistance exercise, strengthening the muscles and joints. So a combination of the two. They also like the idea of an integration of that exercise professional and healthcare team. So important, multiple myeloma can present in a very complex way. So having the medical rehab advice, but also then having that exercise professional as part of that team with that specific expertise to put all that information together to exercise safely. And the idea of a virtual or hybrid delivery model. So again, virtual for those times when maybe you're feeling that higher risk of infection, but also the convenience of maybe doing it at home or if in the hospital, even this program could be done, but having the option for maybe that in-person hybrid delivery model, so that in-person component as well. I'm old school. I like the in-person when I can. I just really feel like I can, help people through the movement for sure. And then the idea of tailoring programs based on the participant status. So this isn't just doing one assessment, setting a program and knowing where they're at and assuming nothing's going to change, but kind of this ongoing idea of tailoring the program to meet the participant where they happen to be on that given day for their exercise. And the idea of a flexible schedule is important, again, to accommodate around chemotherapy, so a lot of appointments, but also the side effects and how they're feeling after, the idea of being able to exercise when they really felt they were up for it. And that enhanced education. So, I mean, we like to help people in our programs for sure, but we can't help them forever. So this idea of enhancing the education, so the knowledge of the participants, so that they would feel comfortable continuing exercise on their own once they're done the program. So all this has kind of led to our recent grant application, which again, we are on behalf of the research team, we are very grateful and thankful to have received the Aldo Del Call grant to continue on and build on this research further. So the grant was awarded for, I'll read the title quickly, a novel e-health application to support exercise rehabilitation prior to stem cell transplant for individuals with multiple myeloma. So just building off that last, really building off the last study for sure, where we found out those preferences of what exercise might look like in that time, and also using what we've seen with the Heal Me app and trying to incorporate that information. And the goal is to deliver an exercise program using that app during this time phase. So the objectives, I just kind of highlighted it, but we want to know again, is this exercise during this period feasible, and delivering the intervention by using the app, possibly the hybrid model with some in-person. Is this going to be a feasible exercise intervention for individuals undergoing that chemotherapy prior to a stem cell transplant? And as far as the objectives, we want to know is the acceptability of the app again. We're continuing to modify it. Is that acceptable to participants as far as use and benefits? And then looking at the preliminary effectiveness of the program. So again, looking at changes in physical function with assessments before and after, and using the questionnaires to get at quality of life and other patient-reported outcomes to see if we're still seeing similar improvements to our other exercise programs. So the methods, we hope to ultimately randomize 30 participants with multiple myeloma to this exercise program. So they'll either be randomized to a 12-week exercise intervention delivered via the Heal Me app, or standard care, which right now would be physical activity counseling from somebody on your healthcare team. So to see if there's a difference, if we actually do this kind of tailored exercise program delivery with the app, are we improving outcomes, the physical outcomes and self-reported outcomes for these individuals? And a bit more specific, so how do we determine whether it is a feasible program? So we look at recruitment rates. Are people actually willing and able to join to be a part of the study? We look at adherence to the actual exercise sessions themselves. So if we have high adherence, the assumption is that it's doable for the participants. If we have a low adherence, then we have to look at why are people not able to attend? Is it too hard, bad timing, bad delivery mode, all these things. And then obviously looking at adverse events. So we want exercise to be a positive experience and not be creating further problems like injuries or turning people off of exercise for sure. Then we look at study completion rates as part of that feasibility. So are people able to complete the entire study and complete the follow-up assessments post-program? And then as far as measures of physical mobility, so this would be things again like sit to stand, balance, those kind of measures, looking at physical function and frailty, patient reports on symptom and quality of life. And then there'll be interviews as well. So it'll be a mixed method study to look at evaluating the design, acceptability, and program features of this e-health delivery through the Heal Me app. So we'll have patients complete program satisfaction surveys, and hopefully if they're willing to participate in focus groups and semi-structured interviews to really get into detail again about what can we improve as far as the app and the delivery of the program to maximize the benefits for the individuals in this time frame. Sorry, I'm probably running short on time, so I'll try to be a bit quicker here. Please cut me off if I need to cut to the question period. But just trying to hopefully finish off here quickly to summarize some of with what we've learned from others who've done research, our own research, to really think about what do we need to think about, again, if somebody with multiple myeloma approaches me and wants some help starting on an exercise program. So as Dr. Koulis-Reid highlighted, there's many potential benefits for individuals diagnosed with multiple myeloma who want to exercise, but because of the effects of the cancer itself and the treatments, there's many things that we want to be aware of. So I won't spend a lot of time on any one, but looking at fatigue, again, a very common symptom we see across cancer, but unfortunately very prevalent in multiple myeloma. Pain, often where the site, if it's involved with bone involvement in those bones, all these things can reduce mobility, create weakness. So we need to be aware of that when we're designing programs and choosing the modes of exercise. A high risk of fracture for many individuals with multiple myeloma. So we really want to prevent that. How can we reduce the risk of infection? And managing shortness of breath, neuropathy, again, are two other common symptoms that we try to work around as best we can. And I won't spend too much on this slide, but historically, multiple individuals diagnosed with multiple myeloma, because of the complexity of how it presents that I tried to quickly go over on the other slide, are often excluded from exercise research, or in the community, people might be uncomfortable working with them. So our new exercise guidelines, we try to reduce barriers to people to becoming active, because we know there's potential benefit, but we also need to acknowledge risk and allow for appropriate exercise programming and supervision of that program, because most people with multiple myeloma, when we look at our risk continuum as far as starting exercise, well, with our guidelines and what we follow for screening, will fall into that intermediate or higher risk for exercise participation. Doesn't mean you can't, but we need to be aware of those risks so we can do it appropriately and safely. So for us, we always suggest that you see your doctor, and as Dr. Koulis-Reid, when we need to fill in the blanks, we contact the oncologist directly. So we're quite lucky to have a good relationship here in Edmonton with healthcare providers at the Cross Cancer Institute. So we can get a bit more information when there is bone involvement, high risk of fracture, where is it, all these things, so we can really work around that and get more information. So we're quite lucky with that. So if you don't have the luxury of that connection between who you're working with from exercise and your healthcare professionals, again, you want to be able to provide them with bone information, blood work, these sorts of things, so they can modify the exercise where needed. If you're having any of those complications I showed related to cancer and treatments like fatigue, neuropathy, shortness of breath, you want to communicate that. So again, the exercise can be modified appropriately. And completing screening for other potential exercise. Obviously, multiple myeloma might be the focus of that initial discussion, but do you have any history of heart disease, other joint issues, arthritis, high blood pressure, breathing issues unrelated to your cancer? We can't just ignore those and not focus on them. We need to look at the individual, and so we can modify for any other reason as well. And then from this, we can then start to determine the appropriate type and level of exercise. So I know the heading says starting exercise, you want to do these things, but it's kind of an ongoing process, particularly if you're on treatment or the disease is progressing, things will be changing. So it's important to have that open line of communication and continue to monitor so that things can be modified and we don't just assume that our baseline will stay the same as far as things we should be concerned about. So things be common that we try to consider and work around. So if there is bone lesions with the disease, we need to be very aware of that, particularly in the spine, just with the sensitivity around the spinal cord. We have to modify and be careful around that. Balance, so if we do have weakness, maybe neuropathy, we're not getting the sensation in the feet, in general fatigue. We don't want people falling when they might have a higher risk of fracture. We don't want people falling anyway, but definitely in that situation. So we always want to be aware of where people's balance are at. As far as fatigue, we know the right amount of exercise should improve it, but too much will make it worse. So looking at how much total exercise we're doing and within the rest of the things that are happening in your life. Joint mobility, again, this might be related to bone lesions or other joint issues that from other old injuries or arthritis, these sorts of things, we need to be aware of that. So then we can start to think, what is the best way to have you exercise? Posturally, what's the best body position? Do we need support on the back? Should we be doing things lying down? All these sorts of things. What equipment is best? Should we just be using our body weight, bands, or otherwise? And the speed, slow and controlled, is always better than. And so I know I'm cutting it really short. So lots of movements that we try to avoid. So uncontrolled movements that are fast, rapid, or stress on the joints, tend to involve muscles that we don't want to, so we can't avoid the areas maybe that we're trying to, where there might be bone lesions. Anything high impact, so jumping is often, we want to avoid that, but definitely contact sports as well. Avoiding spinal rotation and twisting is things that we, or hyperflexing or extending back with the trunk are important to avoid. We want to reduce things that it might risk of falling, particularly if there's balance concerns where we might be at higher risk of fracture. And just looking at the loading around those joints to try to minimize load being transferred to parts of the body that we don't want to. The key here is no pain. Exercise should never hurt, but definitely in the areas where we know that we might be a bit more compromised, we want to be highly aware of not increasing pain in those areas. I don't think I better just kind of escape and stop sharing my screen here. So I'm probably in trouble for going overtime. My apologies. Or do I have a couple more minutes?
Thank you so much, Dr. Sellar, for this great presentation and to show us all the benefits and all the details about this program. So I think it's very good information for our community of patients. I'm going to see in the room if there is maybe just one question. I'll take one question because we're limited in time. Thank you.
Right.
Hi, Chris, it's Laura Lee, and I just have to make one comment and just say to you that I went through the first trial in the onset of COVID, and it really was beneficial. I was able to walk up the stairs one at a time for the first time, and I don't know how long. So, and it was safe. It was wonderful. So my question to you is the same one I gave you last fall. When is the Heal Me app going to be available?
Well, as you can see with the generous funding from Multiple Myeloma Canada, we will be running a study looking at, for now, that specific phase of that chemotherapy before stem cell transplant. So it's a very kind of focused target for that study. It's still, and a lot of my work is in person, so I'm not involved with the app a lot directly, but I know the hope that eventually is that it would be more widely available, but at this time, sorry, Lorelei. You can email Dr. McNeely. She's got more say in those sorts of things, but as it stands now, but our hope is obviously that, as you say, we've got a lot of positive feedback for people that have used it, so we'd like to make it more widely available ultimately.
Do you have time if anybody, there's one question. I saw a hand go up, like, there it is, there. Okay, last question.
Thank you. Hi, I have specific and severe bone involvement on my spine. Can you tell me what can I do? Because I really believe in core strength, core stability, but my spine is very compromised. Would you say Bosu ball, or what would you recommend? Like I can't get
Hopefully they can share my slides. I did have some common exercises that we do try to modify. Core is very important whenever you have, it protects all of our lower backs and back areas. When you have specific you're compromised in those areas, having a strong core becomes more important. I would suggest, and like the things we talked about, I don't like to provide exercise because I have the luxury of finding out more about bone involvement and from oncologists knowing what I can and can't do with people. So I would encourage you, if you can, if you're in Calgary, you could contact Dr. Koulis Reeds and see if any of her programming would be, you could get some help that way, or if you have access to physical therapists in Calgary with cancer-specific training to get that kind of a bit more specific help initially. But often with people with more extensive bone involvement, we're doing core exercises on our back. So even doing something which might seem like it's not a good core exercise, but if you really concentrate on engaging, doing a pelvic tilt where you're lying on your back with your feet flat, knees up. And we don't punch people in our programs, but it seems to be a good visual. If you say I was going to kind of reach and punch you in the tummy, you would kind of brace your core and pull your belly button in, or if you're on your back, you can put your hands underneath your back and kind of push your back into the bed that you're lying on. And that is a great way to engage the core. You're supported. So that's kind of generally a safe way to start. I hate to give too many specific recommendations when I haven't met you and having all that information. But that's generally a safer way to do it. Bosu balls, I don't even like to use, kind of increases the danger level. You don't need to, people used to do hundreds and hundreds of crunches and full sit-ups. And what we find is that really doing kind of smaller, focused, controlled movements, we actually engage the core. And this goes for anybody, not just people diagnosed with multiple myeloma. But those movements, when we really focus on engaging it, as opposed to trying to do big, fancy movements or a lot of repetitions, we tend to use everything but our core. So that would be kind of just a simple one. But I think, you know, like I said, I don't like to give too much just because I don't know your whole situation.
Thank you.
Well, thank you so much, Dr. Sellar. I just want to know who the brilliant marketing mind was who came up with the acronym Heal Me.
Yeah, you can't have a good research study unless you have a good acronym. So
Yeah, yeah, apparently.
criteria number 1.
Yeah, it's got to be better than crab. Thank you once again. We really appreciate that. And we wish you really good luck and hopefully speedy research so we can get that app really quickly out to everybody. So thank you once again.
No, sorry for running over. Thank you so much for having me today.